Hey y'all, it's Marilu with Nursing in Progress. Today I want to go over the fundamentals exam 2. I do have a few notes that I kind of want to share with you guys. This is not the actual test. Okay, so let's move on. Alrighty, so let's start with hygiene. Actually, before I continue, I want to tell you guys. Okay, so on this specific video, I'm only gonna be sharing medication and hygiene. I'm actually gonna make a second video regarding the other chapters. I just wanted to get this one out there so that you guys could like have it in the meantime while I work on the other one, because I didn't want to like have you guys wait, and I know exams are coming in and I just don't want you guys to wait. All right, so let's move on. Anyway, hygiene overview. Hygiene and oral care is a must to know. What's hygiene? Hygiene is activities involved in maintaining personal cleanliness. Oral care, we need to know how to take care of an unconscious patient. There's actually going to be a question in there about unconscious patients, what we would do in regards to them. There might be a few in there that I'm going to be talking about, which I believe might be on the test. But anyway, let's move on. And there's actually a little thing in there that I actually put in the video. And I also have PDF cards to share with you guys, or a link so that you guys can watch this PowerPoint. To not use a limit glycerine swabs, because that could actually make a patient's mouth dry. And hydrogen peroxide actually causes irritation to the mouth, so that's not good, especially for an unconscious patient. So it's a little good thing to know that. And then once you know that, once you take the test, there might be a few questions about that, and if you know a few things like these, you don't even have to like worry about that. Anyway, let's move on. All right, so hygiene, must know, facts to know, may or may not be on the test, but will help you answer questions. Again, I'm here to help you guys out with answering the questions, not to get the specific answer, because then you wouldn't really learn, and I wouldn't really learn teaching you. But yeah, I try to put in questions in here that I feel like are probably going to be on the test and might help out. So let's move on. All right, so facts to know. For clients who need foot care or diabetes, we need to inspect the feet daily, wear shoes when out of bed. I know this was actually on the ATI book, stated about specifically about patients and foot care. So that's something that is probably going to come up either on this upcoming up test and probably on the NCLEX. So something good to know. Elderly patients with diabetes are especially at risk for development of foot related complications. So just know that. Anyway, moving on. If a patient takes anticoagulants, remember, patient must use an electric razor for shaving. You don't want to give them a regular razor and then they're bleeding. Think of anticoagulants as something that makes you bleed. I think of the song of I forgot her name, but she sang that one song, keep bleeding, keep bleeding and whatnot. Remember, keep bleeding. There's actually like a nursing meme about that. So just think like anticoagulants, lots of blood, and if patient bleeds, he will bleed a lot, and that's when the song comes in, keep bleeding, keep bleeding. Don't feel like singing, but yeah, anyway. Example question. If a patient takes anticoagulants, what instruction is the most important? You're going to use an electric razor for shaving, not a regular razor, because they're going to bleed, and that's when the song comes up in your mind, and hopefully that question pops up and you get that right answer. All right, moving on. Nursing diagnosis to know for this chapter. You need to know your nursing diagnosis due to the fact that as nurses, we do not diagnose patients. We just basically diagnose how the patient reacts to the symptoms. So that's what we diagnose. So therefore, in this case, it would be bathing self-care deficit. So meaning that deficient. I don't know why I put okay, anyway. So in this being said, when you think of bathing self-care deficiency, what do you think of? Like, do you think of like, oh, the patient can't take a bath on his own? Of course not, they can't. So it would be appropriate if patient cannot get in and out of the bathtub, independently. So example question would be, if patient cannot get in and out of a bathtub without assistance, which nursing diagnosis is appropriate? And you're going to put bathing care deficiency. Remember, patient needs help, bathing self-care deficiency. Now, if you're looking at the PowerPoint, you notice that I have a nurse right there with the baby. So when this diagnosis comes to mind, I think of like a patient being like a big baby. And like, like when you bathe your baby, like you're bathing the whole body. You're not just bathing like the specific parts, you're bathing the whole body. So since you're bathing the whole body, just think of it like you're bathing the whole patient's body. You're there's nothing that you're missing. Like when you take a baby like a bath, like you have to get from head to toe. So just think whole body, head to toe. And if a patient has bathing self-care deficit, that's what you're gonna do. You're gonna get and take care of him, the whole body, because he can't really do anything. Later on we'll get into partial, but right now let's just worry about that. Nursing diagnoses are very important to know specifically for this chapter. Okay, now let's delegate to the NAP, nursing assistant personnel. Again, this is only for hygiene. So what can you delegate to a NAP? So you're going to see a lot of questions about this. Just remember, a NAP cannot assess a patient. They're there to help you. If a patient is stable, it is okay for a nurse to delegate to the NAP. Example question: what kind of patient can a nurse safely delegate to a NAP? A 60-year-old who underwent surgical repair of a bowel obstruction 2 days ago. Now, the reason why I put the answer right there and why wanted to talk about this is because patients should be stable. Now, if the patient's not stable, that's when the nurse would come in. But in this case, like they're just giving you like a regular scenario, and they're saying, okay, this patient, he's a 62-year-old. He comes in, bowel obstruction 2 days, most likely he's going to be okay. According to statistics, he's going to be okay, right? So patients should be stable. Think of a pregnant woman having a nap. Help her after she had a baby, because she's good after she had a baby. Generally, if she had a complications, then a nurse would assist. In this question, patient would be stable. So like an example I kind of wanted to give about this would be like so I had a baby, and when I had a baby I had a lot of complications, so therefore I wouldn't get a nap, because since I have a lot of complications with my pregnancy, I wouldn't have that. Now my sister, she had her baby like normal. She, after 24 hours she was good to go. So she, after the 24 or 48 hours, whatever you want to call it, a nap would go and assist, because most likely she's fine, she's okay, she was okay, she was already like good to go within 24 hours, which is amazing to me. But because me, I don't know, like I was literally there forever due to the fact that I had complications. But you see, so it's like a nap would not been able to help me because I had a lot of complications. So that was my thing, where with my sister it would have been able to help her because she was good to go. So that's what they're there for. They're there to help out. Alrighty, so let's continue. Nursing diagnoses are very important to know in nursing. As stated prior, risk for impaired skin integrity, anything having to do with pressure, shear, friction from immobility, put an individual at risk for skin integrity. Think of damaging the skin. Example question would be, a patient's epidermis has insufficient melanin. What is a good nursing diagnosis? Risk for impaired skin integrity. So a lot of these nursing diagnoses having to do with the skin, damaging it or anything like that, the first thing that should come to mind as a nurse should be risk for impaired skin integrity. Remember, risks at risk for damaging the skin, always. So I also put in there that it equals risk for impaired skin integrity. So anything that's damaging the skin equals risk for impaired skin integrity. So just think damaged skin equals nursing diagnosis, risk for impaired skin integrity. That would definitely be important to know, especially for the test that's coming up, and for health assessment integumentary. That's going to be very important to actually know as well. All right, let's move on to the next. The body's first line of defense. What is the body's first line of defense against bacteria? So what is the largest organ? The largest organ is the skin. And that is actually the answer, intact skin. Do not confuse white blood cells, lymph glands, or inflammatory response with this. The reason why the question wouldn't be white blood cells would be that white blood cells are inside our human body, not outside. And the first line of defense is the skin. So if you were to put white blood cells as the answer, white blood cells are already in the skin, so therefore it's like the bacteria already passed the gate, which is your skin, so they're fighting inside. Lymph glands are also inside the body, so it fights bacteria already in skin, not outside. I usually call the skin like the gate, and that's why I always say the gate, but the skin is like the gate, and if the bacteria were to pass the gate, which is the skin, then that's when it would meet the white blood cells, lymph glands, and all of that. Inflammatory response, that's actually a response, not something that's fighting bacteria. So let's move on. As a nurse, we don't officially diagnose, but we need to know a disease. With that being said, we have our own diagnosis. Nurses have their own nursing diagnosis. They don't diagnose like a provider does or a doctor does. What they're diagnosed, if you have diabetes, if you have, all this other stuff, where a nurse is just like, we monitor the response, and that's what we are there for. We're there to look out after the response. So that's actually good to bring out. Here's a question. So if a patient has a yellow skin tone, we need to know that he or she has jaundice. Example question would be, well, on the test, it might say something like, well, nurse notes patient has yellow skin tone, or something, about yellow skin tone. I'm now actually only bringing out the keywords, which would be like a yellow skin tone, which indicates this finding, you would be like, oh, it would be jaundice, because it's yellow. Another things to know would be pallor. Pallor is pale skin. Erythema, that's redness of the skin. Cyanosis is bluish. So pallor is pale, erythema red, cyanosis is blue, and jaundice is yellow. And it could actually be on the sclera as well, which would indicate that the patient has liver issues, but we'll go more into depth another video in regards to that. Let's move on to the nursing process and the hygiene questions. Which patient will require frequent perineal care? Active lower GI or history of acute asthma? So if you think about it, out of these two choices, you wouldn't really choose asthma, because asthma wouldn't have anything to do with perineal care. Now, active lower GI bleeding is active bleeding, So remember when we talked about the risk for skin integrity? This is going to come up as well, because the patient has active lower GI bleeding, meaning that there's something going to happen there, which patient might get, redness or risk of skin integrity due to the fact that they keep, it's active lower bleeding. Therefore, he needs frequent care because he may have an irritating effects. And I put in an example of think of a baby with diarrhea. Baby needs frequent cleaning, because then he or she will have redness on the skin, which causes irritation. So that being said, if you have a baby and the baby has issues, you're going to be cleaning that baby or be looking out after that baby every 30 minutes, every hour. And you want to see, like, okay, I don't want, my baby to have anything red. You would probably put some baby powder in there so that, the skin won't, keep inflating or get red. And that's how like, okay, if I know that this is what I have to do with the baby. Obviously, if a patient has an active lower GI bleeding, you're going to keep frequently wanting to go check the perineal care. And sometimes this patient might need help, so that's what the question basically means. So if a patient would require frequent perineal care, that's what you're doing. You're looking for something that's active, something that's happening at the moment, the here, the now. So that's what I indicate for that one. Now let's move on to a complete bed bath. A complete bed bath is washing the entire body. For this one, I have an example, but I'll put I'll talk about the example question first. The nurse is teaching a nap how to give a complete bed bath. What instructions would the nurse use? A, cleans only the areas that likely to cause odor, or B, bathe the patient's entire body from head to toe, cleanest area to first. And the answer is B. Why? Because partial bath equals clean areas that are likely to cause odor. So partial bath, clean areas, odor. So you're just gonna clean the areas that are gonna cause the odor. In the book, it kind of states something about perineal care, armpits, or the professional word would be axillary. That's what partial care is. You're only cleaning out the parts that are smelly. So partial bath, when I hear partial bath, I think like, oh, that's smelly. Those are the smelly parts in the body, which would be the perineal care, or the axillary, the armpits, whatever you want to call it. Where a complete bath, I think about it as a little baby, that you're washing the whole baby from head to toe. You're obviously not gonna want your baby to get anything bad in their eye or anything like that. So that's why you're gonna clean from the cleanest area first to the dirty areas. And that's how you would clean the baby. You wouldn't want to have your baby get like a eye infection or any perineal infections, anything like that, because you didn't clean them correctly. So that's what it means when it states cleanest area first, and then dirty area. All right, so nursing diagnosis. Here we go again with the nursing diagnosis. I know I'm probably annoyed with that. You're probably annoyed with that, but okay. Nursing diagnosis, activity intolerance. When you hear activity intolerance, I want you to think that we don't want to waste the patient's energy. You need to know that towel bath, modified bed bath, large towels, that's what is mainly used for a towel bath. And the nursing diagnosis was activity intolerance. We don't want to waste a patient's energy. So just think of a patient, or like a patient that they can't move anything. So we need to get a towel. And once we get the towel, we're going to clean their whole body, right? They're not moving anymore. So it is technically complete, but this one's more specific to what type of bath it is, which would be a towel bath. And what you're doing with that is the patient's not moving at all. So since the patient's not moving, that's when you're going to take in charge, and you're going to be doing everything. So an example question for this would be, patient has COPD, has a diagnosis of activity intolerance. Which type of bath is preferred? You're going to put towel bath. And with towel bath, we're going to, according to the book, it states something about dementia patients as well. When you have a dementia patient, you want to give them a towel bath. So that's something that you definitely want to know in regards to the test, because there's definitely going to be a question about that. All right, let's keep doing the questions. Example questions and things to know. All right, so wearing properly fitted shoes causes, wearing poorly fitting shoes causes ingrown toenails. So that's the main reason why a lot of people have ingrown toenails, because they want to wear shoes that are smaller than their feet. Just admit it. If you have wide or fat feet, just wear the shoes that you have to. Trust me, I know it's kind of bad, but you have to. You don't want to get that ingrown toenails. I've actually seen some YouTube videos that have shown where people are like have some ingrown toenails, and it's gross. Trust me. Okay. Anyway, bath water should be prepared at what temp? So the answer is 105 degrees, 40.6 Celsius for bath water. I would just, bath water temperature, I would just think of 105 degrees, 105 as I don't know. In my mind, I think like 105 station. So I don't know, like, like when you're listening to the radio and whatnot, I'll just think of 105 degree or, something like that. Anyway, let's move on. If a patient has excessive brittle nails, what does this finding suggest? It's gonna suggest that the patient has inadequate dietary intake. All right, so let's do more hygiene questions. A patient is unconscious. How should the nurse position the patient? So if the patient's unconscious, you're going to put the patient on their side, and the answer is going to be sideline. You're going to put them on their side, or they're going to lie on that side. And this is actually also a quiz question, just so you guys would be aware. Probably already took the quiz, but just giving you a little heads up on that as well. So, what item is best for providing mouth care for an unconscious patient? You're going to need a foam swab. You're going to need to be very careful with the patient in regards to making sure that their mouth is clean, but you want to be careful. So that's why you're going to need the foam swabs. Why? Because swabs are typically used to provide mouth care for unconscious patients. You want to be as delicate as you can for those patients. All right, let's keep going. Example questions for hygiene. You must know. Okay, some vocabulary to know. Pediculosis is head lice. Pediculosis, head lice. Alopecia is hair loss. Alopecia is hair loss. Generally, what happens with patients with chemo, they have that. So just know that specific word, and then there might be a test question about that. And you might just be like, what? Oh, I didn't know, but now I know. Or you might already know. Either way, it's good to have a little review. Hirsutism, excessive hair growth in women. When women have like a lot of hair on their face and, they're just hairy and whatnot. They might have like a thyroid problem or some issues going on in their body. Example question would be, patient has chemotherapy and starts to lose hair. What adverse effect would be documented? Obviously, it's not pediculosis because that's head lice. It's not hirsutism because that's a lot of hair in a woman. So the right answer would be alopecia, and that's hair loss. All right, moving on. Example questions. Again, the nurse reviews contact lens care with the patient. What statement from the patient indicates that the teaching was effective? The patient states, I will use saline to clean my eyes. Also, I kind of wanted you guys, I put a little thing, must know there. Do not use water for that. The right question would the right answer would probably be, I will use saline to clean my lens. So that would be the right answer for that question, that type of question. So just be on the lookout for that. When a nurse is caring for a patient for a closed head injury, which action by the nurse is appropriate for the patient? So let's think. Okay, patient has a closed head injury, so they're having issues with their head. So obviously, the answer would be, we need to provide care in small intervals, meaning that we're not just going to rush a bath or something, where they could be at risk for fall or something. We want to make sure we take our time and we do everything in small intervals, take our time, do everything little by little, and if they want to rest, we'll let them rest, and then we'll come back and we'll do that. We'll continue with the bath and whatever we were doing with that one patient. All right, moving on with the other question is, when can a nurse provide a back massage to help the patient relax? Well, it would most likely be when the patient's about to go to sleep, right? So the answer would be hour of sleep, because it's promoting relaxation. The patient's about to go to sleep. They want to relax, All right, moving on. A patient with dementia becomes belligerent. When the nurse tries to bathe him or her, how should the nurse proceed? The nurse needs to wait for the patient to calm down, then give a towel bath. Alrighty, which action should the nurse take when preparing a patient for a bed bath? Make sure the patient has a call light and the call device needs to be within reach. Call light is very, very, very important, okay? So that is a good answer. Okay, we're going to move on to chapter 25, module 6. I know I skipped a module. I was in module 4, but now I'm going to module 6. I just skipped that one because I wanted to go in order. It's just the way my brain works. So I went to chapter 25, just a little overview, and then I'll make that second video for you guys. All right, so module 6, going in order, chapters, not modules. All right, things to know. Side effects. Side effects. Remember, unintended effects, predictable. They're predictable in, I don't know why I put that, but it's actually predictable effects. Adverse effects are actually unintended effects. Toxic effects are damaging effects to the organ. So anything that's side effects, you already know it's going to happen. So if a person takes an opiate, you know that blood pressure is going to go down. Adverse effect is something that you're like, what's going on? Why is this happening to the patient? You don't know unintended, like a patient could take a medication and it could be very, very bad for them, toxic effect, damaging effect. You're damaging the organs. That's what toxic is. All right, let's talk about pharmacokinetics. Must know. Absorption, movement of drug of administration. So absorption, think from point A to point B. So the drug moves from point A, which is the site of administration. That site could be IV, PO, intradermal, whatever the site is, right? Point B is the bloodstream. So just think of it like, okay, we're going to give the patient by mouth. Now let's go, and it's going to go to the stomach. That's point B. So it's just giving you examples like that of how I look at it. So that's point A to point B. So remember, absorption, think point A, point B, the movement of the drug site of administration. The drug is moving. All right, distribution, keyword, transportation. Metabolism, how your body breaks down the medication. So that depends on the metabolism. Excretion, just think exit. Excretion is exit, excretion, EX, and then exit, EX. Removal of the drug of the body. So hopefully that helps out. Real quick, therapeutic range. Peak level, drug is at the highest concentration. Keyword highest, which is the peak. So think roller coaster. You're on top, you're about to go down, you're on top of Superman, Goliath ride, you're up. You're like at the peak. Peak is like you're up there. Throat level, drug is the lowest concentration. So you already went up, you already went on the roller coaster, now you're going down. That's the throat level. Think roller coaster is going down and your body's relaxed, and the fun or scary part, whatever the way you look at it, you're already down there. So that's the throat level. Keyword is lowest for throat, and keyword is highest for peak. Onset action, time it takes for the drug to reach the therapeutic level. So onset would be, you know how the ride is like 5 minutes, or usually very, very fast. That's the onset. The onset could be 5 minutes, 10 minutes. So that's the time. Like sometimes you wait in line for like 2 hours just to get on a ride, but you just get on the ride and it's like 5 minutes. That's the onset time. That time that you went up there, you did the whole up and down, the loops. That's the onset action. Alrighty, so the next one. The drug name is furosemide. What type of drug is this? Answer would be a generic drug name. Furosemide is a generic drug name. So just be familiar with the generic name and the brand names of the medications. That would be very helpful to know, especially for this test. Some medications that are common, they're not going to give you medications that are hard to know. They know furosemide. Most people know it's a generic drug name, or it'll be like a drug that was on the book. If a nurse is unfamiliar with the drug, which action should she take before giving out the medication? Well, she would use a drug formulary, which we have the Davis Drug Guide. Another thing I wanted to say about that is like, yes, you might ask your friend, oh, what's this medication for, or blah blah blah, but your friend might be familiar with it, but they don't know like the peak, the onset, and all that. If they don't know that, and let's say the patient needs it for something specific, it might affect the patient. So it's better to just check the Davis Drug Guide, and that would be better. You could also ask the pharmacist, but the most obvious choice that the test might want you to answer would be Davis Drug Guide or drug formulary, whatever you want to call it. Alrighty, next question. If a nurse doesn't understand a provider's order, she should seek clarification from the provider. Again, don't ask your friend, oh, what do you think this says? What do you think this says? No, ask that specific provider, hey, doctor, or, provider, what does this say? Can you verify? Can you, specify? Can you please tell me how this is? That is going to make your life easier, and that's probably going to be on the test, and you're probably going to want to put that in there. All right, more questions. Let's go. If a nurse needs a narcotic, where should the nurse expect to find the drug for administration? Okay, she's going to basically expect to find it in a double-locked medication drawer, because it's a narcotic. Narcotic are not just regular medications. They're, narcotics, and they're called narcotics for a reason, right? So they would definitely be in a double-locked medication drawer. So that would probably be the answer for the test again. pharmacokinetics question, which we kind of already went a little bit over pharmacokinetics, but I just want to say it. Which term refers to a movement of drugs outside of administration? So that would be absorption. Remember we talked about absorption, where I told you guys movement of the drug from point A to point B. You're moving from PO to stomach or IV to bloodstream, you know, so that is absorption. Remember that, because that is definitely important to know. All right, so let's move on. So which drug route has the highest or fastest relief? Which one is it? Drum roll. And it's intravenous morphine sulfate. Intravenous, venous. That's all you gotta know. Like intravenous, that's the fastest route. It's gonna go into the blood. You don't have to wait 30 minutes or whatever minutes so that, you know, the medication could, you know, go in there and dissolve and do all that fun stuff. It's gonna go in there. You're good to go. Patient, you know, might be in all this pain, and you know, you're just taking out all the pain. You know, obviously if you get that order from the doctor, you're gonna take out that, you know, get that pain out. You know, you're not just gonna give them a pill and wait for 30 minutes for them to be in pain and be like, oh, well, you're gonna have to be in pain for 30 minutes because, well, I only have pills, you know, stuff like that. No. So remember, venous route is the fastest, and then oral generally the slowest. I usually think of a person in a lot of pain, as I mentioned, and how to take their pain away. You would do it in intravenous, not orally, because someone in a really, really bad pain wants relief ASAP now. Chapter 25 questions. What term is used to describe the time it takes for drugs concentration to reach a therapeutic level? So we did talk about that. Remember, we're talking about the time it takes for a drug concentration to reach the therapeutic level. Time always, and it says time of the drug to reach the therapeutic level. Remember that onset time? Remember waiting in line for like 2 hours just to go into that ride for 5 minutes? That's literally how I think of a medication. The medication is gonna give you like that little roller coaster 5 minute. Not all medications are 5 minutes. I'm just saying, like, that's how I think about it. Like, you're going into, you know, the roller coaster, you're waiting there 2 hours, and then you go into the roller coaster, and then it's like 5-10 minutes, 20 minutes, whatever, max, whatever. That's the onset of action. So the time the drug concentration to reach a high enough level of blood, so it's going. So just think of time, onset time it takes. Okay, which factor in a patient's medical history is more likely to prolong half-life of the certain drugs? And that's the liver. You must know that metabolism generally most likely takes largely in the liver. So yeah, some medications do affect the kidney more than the liver, and some, mostly medications affect the liver than the kidney. So here is my PowerPoint to you guys. I hope you guys enjoy it. Good luck on your testing, and then I'll bring out the second video later. Okay, bye guys.